My name is John Sevransky, the editor-in-chief of Critical Care Medicine, and I'm fortunate to be here with two experts, David Maslove, who's a senior editor for Critical Care Medicine, and Pat Lyons, who's an associate editor for Critical Care Medicine. We are here to briefly discuss an article from the January issue of Critical Care Medicine. And I should note that the January issue will be the first issue of Critical Care Medicine that will be available solely online. The article that we're going to briefly chat about is involved with the care of patients with sepsis. And the reason that we chose this article is, to date, the only things that have been shown to improve outcomes in patients with sepsis are early antibiotics, source control, and performance improvement projects. Towards that end, I would like to ask David Maslove, who was the handling editor for this particular article, to introduce the name of the article and talk a little bit about why he selected it.
Thank you so much, John. So we're excited in the January issue to be publishing Heterogeneity and the Effect of Early Goal-Directed Therapy for Septic Shock, a secondary analysis of two multicenter international trials by Shaw et al. And this we thought was an important study to highlight because it speaks very much to that point that you just mentioned about the lack of positive randomized control trials in sepsis care over really a number of decades now of research. And this study is an attempt to extract more usable information and data from a reanalysis of some of these trials in a way that brings us a little further down the road to precision medicine in critical care. So specifically, these authors reanalyzed data from the ARISE and the PROCESS trials, which were trials of early goal-directed therapy, in order to identify whether there was heterogeneity in the effect of those treatments across the cohorts included in those studies, and indeed found some important heterogeneity, leading to an important sort of reconsideration of where this evidence leads us and leads our thinking in the treatment of patients with septic shock, sepsis.
Thank you, David. So, Pat, can you talk a little bit about, this is obviously a reanalysis of two previously performed trials. As somebody who thinks a lot about predictive models, what type of evidence would a clinician need to see in order to use one of these reanalyses or sub-reanalyses of particular phenotypes or subphenotypes to change their clinical practice?
Sure. I think it's the one that's on everybody's mind as we see more and more of this kind of work. So I think these analyses are always really exciting and they're thought-provoking. But I think that, to close that gap, there's probably 3 or 4 key things that we'll need to see. So one is reproducibility. And I think the authors actually did a really nice job of demonstrating that in this analysis. So it's not just in one cohort on one single analysis, but it's valid, sort of taking from one group and going to the next. The second one is robustness to some kind of sensitivity analysis. And so making sure that the findings that you're seeing are actually due to what you think they are, as opposed to due to some sort of insidious outsider effect. And again, the authors, I think, did a really nice job of putting this work through a series of those. So those 2 bars, I think we're on the way to meeting here. The third is probably the idea of like something actionable and implementable here. So, we can run these models, but could we run a model like this in real time for patients as they're presenting? And so is it making use of information that's actually either available or at least like attainable at the time of kind of clinical appearance? And then, is it paired with some kind of a discrete intervention or a package of interventions? And I really like how the authors tried to take steps in that direction by understanding what are the components of goal-directed therapy that might be kind of mediating the effects here. And, those findings were inconclusive in this analysis, but I think that's the direction we have to go, is to make sure not that we just find groups of patients who respond differently to some sort of a vague package, but really understanding what it is about that package of interventions that's making the difference. The last thing is really that we need to see this evidenced in prospective trials. And so making sure that we can actually build out something that we could test for patients in ideally a randomized fashion to make sure that this actually bears out. There are at least one trial that I'm aware of now that is enriching enrollment in a sepsis response based on a sort of less individualized, more broad strokes subphenotyping approach. But I think that's the direction we need to go.
So you have heard from Doctors Maslove and Lyons about the article Heterogeneity of Effect of Early Goal-Directed Therapy in Septic Shock, a secondary analysis of two multicenter international trials by Shah and colleagues that will be found in the January edition of Critical Care Medicine. Thank you all.